coffee chats. We are glad that we are back with those, and throughout the month of February we are going to be focusing on self-care, wellness, and what a great way to start talking to our neighbors in the building, the Gauld Ankle and Foot Clinic, Dr. Bergstrom, and Fatima will give her title of what she does in the clinic, but I would love to welcome them to talk about conversation that we started a few months ago. We talked about nail health and care, which to us as dermatologists is very important because it can represent many changes that go on in the body. We very frequently are asked about the care and some of the trends that our patients enjoy in taking care of beautiful nails with Valentine's Day coming around. So welcome to both of you, and I'd love for you to introduce yourself and kind of tell us a little bit of what your role in the practice is.
Awesome. Hi everyone. Thank you, Dr. Pare, for having us again. I'm Dr. Bergstrom. I'm one of the podiatrists upstairs at Gauld Foot Ankle. And really excited to be here because we have a new addition to our practice, and it's called Sona. It's a medical pedicure spa, and we brought on Fatima, who is our new nail technician. And so now we're offering medical grade pedicures at our location.
I'm so excited because we touched upon that last time, and I can't wait actually to meet Fatima and talk more, not just here, but maybe as one of your clients. So please introduce yourself and give us an idea a little bit on what you focus on, what your training is.
Yes, so thank you for having me. My name is Fatima. I'm a licensed nail technician and certified master pedicurist and nail educator here. And yes, we doing medical pedicures. We focus on offering pedicures that are safe and that are diabetic-friendly, and it's an alternative to, as opposed to just going to a regular salon for clients who may have health concerns.
You know, and I think that leads beautifully to one of the things that we were going to talk about a little bit. What is the difference between a manicure and a pedicure that you would get in a salon that so many of us enjoy versus a true medical approach?
Yeah, so one of the main differences in the services that we offer versus that you would receive in a nail salon is just that we're focused upon the client's health. We don't diagnose, we don't treat, but we offer recommendations, and then we make the recommendations based on the client's health.
Yeah.
We also send clients home with a regimen that's something that they can do themselves to improve their health and really see results, as opposed to just coming, spending all this money,
Sure.
but not seeing their condition improve.
You know, and I think, somebody who spends all my life setting up, feet are so important, and that's where you come in. As a podiatrist, I'm sure that you start the conversation with the patient and then maybe refer.
Yes.
So what are the most common things that would work beautifully together? I mean, you've mentioned diabetes. Patients that have history of diabetes, I'm sure, present with changes.
Yes. And so it's great having Sona now as part of the practice, because as Fatima was saying, it's a safe place for patients that are high risk, prone to infections. So a lot of times I see patients in the clinic who may not necessarily need a lot of follow-up with me in the office, and I can send them to a safe place, which is Sona, to have more maintenance done on their nails. And the reason why we like Sona is, one, it's waterless, is that can actually exacerbate a lot of different foot and ankle conditions. Two, our instruments are sterilized in a manner similar to surgical instruments. And then three, they're overseen by the podiatrist. So we have a lot of back and forth between Fatima and us, so there's a lot of oversight with the patients.
I think that that's so important. I know that we see as dermatologist patients that have nail fungus, so would that be appropriate? We mentioned the treatment. I'd love for you to talk about this again, because I actually have referred a number of patients to you with great results. So let's talk for a second about microdrilling, and then maybe how do you address nail fungus and whether there is an appropriate place for a pedicure.
Absolutely. So a lot of patients come in, they complain of discoloration, thickening of the nails, and a lot of times we'll diagnose them with nail fungus, whether or not it's through clinical exam or potentially a small little biopsy of the nail. But the way that we like to treat this is a lot of times topical medications. We have a lot of trouble getting the medication into the nail. So what we do is micro drill, it's painless, and make a small grid pattern on the nail so it allows the topical to sink into the nail treat the nail plate as well as the nail bed. And a lot of times we'll augment this with lasers and as well as oral medications. And having Fatima with us, it's great to be able to have our fungal nail patients can have their nails treated in a safe environment at Sona. So they may not want to go to a normal nail salon for this.
I think I love that idea of sterilization of instruments, for that particular patient, but also for others that come, because that to me is such a big difference, between going to a regular nail salon versus a medical one. So what are the, this is the Valentine's Day is coming around and the great holidays, and we talk about lips, we talk about hair, we certainly talk about nails, and we're all tempted to have a manicure that lasts long and looks great. But there are some concerns about some of the trends that we see in salons. Can you talk a little bit about those?
Yes, so some of the common trends that we'll see in salons would be like gel polish on the toes or even acrylic toenails. One of the reasons that this trend can be harmful is just because these products are porous, and with them being porous, they house fungus or can house fungus. Sometimes when you take that and pair it with a big luxurious foot bath and a sugar scrub, now you've also fed the fungus sugar and moisture, which are its two favorite things that really help to grow fungus. So we offer a toenail enhancement alternative that is non-porous, and it's also flexible. One of the reasons why the flexible enhancement is helpful is just because, again, with acrylic toes, it's a hard product. When clients are wearing it in their shoes, it can cause permanent damage to the nail plate that over time, if we think we need the acrylic toe starting out, over time, aesthetically, you would need it.
Yeah, that's very true. And I know, is that same true for fingernails, or do you mostly focus on feet?
So yes, we do offer manicures. The manicures that we offer, we don't use any kind of acrylics or gel polish, but we do offer the alternative of having non-toxic polishes.
I know that we see patients that after they've been wearing either the gel or acrylic nails, the nail gets very weakened, and that aesthetically ultimately is an issue as well. So that is a terrific alternative to know, because I don't think that there is any significant benefit, not actually a drawback. So then the brittle nails, are much more prone to potential infection. Do you chat with patients about the benefits, podiatry and the medical pedicures as part of the diagnosis, as bone alignment? Are there any tricks that you share together as potential foot exercises or stretching of ligaments? Does that ever come into conversation?
Definitely. I mean, we see from anything from fungal nails to patients that are walking barefoot and they pick up different things or different types of injuries. So we treat anything from fungal nails to plantar fasciitis to fractures in the foot. But it definitely is something that I have patients, I do benefit from some barefoot time and different stretching exercises based on the type of injury that they come in with.
I think that that's important to remember, that there's, we keep reading a lot about prevention, and that's another theme of the month of February. So that preventive aspect, not necessarily running to have a surgical correction, that there may be some kind of a little bit less invasive approaches as well. I think that that's 100%. Important too. So are there any safe things that patients can do, to really have beautiful long nails and enjoy the great look of a manicure?
Yes. So one of the safe things that clients can do, first for their feet, you can keep your nails clipped short. That'll help to ensure that they're growing in properly and healthy. But on your hands, one of the things that we could do is help to keep our hands moisturized, oil our cuticles, and minimize the use of gel polish as much as possible.
How frequently do you suggest, and I'm sure it's different, if you're dealing with other more medically focused issues, the recommendation can be different, but what's the typical frequency for a manicure and a pedicure?
I recommend that clients get a manicure every 2 to 3 weeks while they get a pedicure every 3 to 4. The nails on the hands and feet grow at different rates, so I think that for healthy nails, 2 to 3 weeks is ideal, and 3 to 4 is ideal for pedicures as well.
So I think you can have a great glow up with nice frequency, and the month of February, just like any other month. But I think when you start thinking about fungal infections, it does take a few treatments. So clearing up the nails before the spring, summer, when we start wearing sandals, I think this is a great time to start, don't you think?
Absolutely. I tell patients all the time when they come in the winter, I'm like, this is the perfect time.
Yeah.
One, it's great because, you know, a lot of the treatments is multimodal, and we need them to have, you know, either friendly polish on or being able to put on different topicals. It does take about 9 to 12 months to clear up severe fungal infections.
Yeah.
And so it's great to do during the winter.
I think this is, to me, medicine at its best, when we collaborate as specialties, you know, and it's so wonderful to have you here, because we do, as dermatologists, talk to our patients a lot about nails. So now that we have Sona, I think this is so wonderful. Can you tell us one more time what the hours are, and when specifically where you're located?
Yeah, so we're located in Marietta and Buckhead, and right now we're located in Marietta on Mondays, Wednesdays, and Thursdays, and in Buckhead on Tuesdays and Fridays. You can book us online at medicalpedicure.com. And I, Fatima, am your pedicurist, but we certainly have a growing team.
Okay, wonderful. And what are you open on the weekends, or this is during the week?
Yes, coming soon. We will be open on the weekends soon.
Well, Dr. Bergstrom, thank you so much for spending time. Fatima, I can't, you know, I am going to be on your schedule for sure. I can't wait. And remember that you can have beautiful looking nails. You can have the great glow up around the holidays, but you can do it in a very healthy and safe manner. Thank you both so much.
Thank you.